All right, let's talk about joint pain, specifically two conditions that can be absolutely agonizing: rheumatoid arthritis and gout. Now, you might think pain is pain, but the way we treat these two can be more different. And today, we're going to get into the fascinating reason why.
So this is the big question, right? How can two diseases that both attack your joints require such completely different battle plans? Well, it's because it's not just about the pain. It's about tackling two totally different problems happening deep inside the body. Let's start with the first one.
First up, we've got rheumatoid arthritis, or RA for short. And honestly, the best way to wrap your head around RA is to think of it as an inside job. It's basically a case of friendly fire, where the body turns on itself.
And that phrase right there, autoimmune disease, that's the whole story. Your immune system, the thing that's supposed to be your personal bodyguard against germs, gets its wires crossed. It makes a huge mistake and tags the lining of your own joints as the enemy, launching an all-out attack.
And that attack happens in a chain reaction, what we call a cascade. So step one, mistaken identity. Step two, the immune system sounds the alarm by unleashing these little signal molecules called cytokines. Think of them like emergency flares. And step three, those flares call in the cavalry, inflammatory cells, that show up and start releasing enzymes that literally chew away at your cartilage and bone. So, how in the world do you stop your own body from attacking itself? Well, you need a pretty sophisticated toolkit, one designed to cut the wires of that inflammatory cascade at just the right points. Let's take a look at how it works. I love this analogy because it just nails it. You've got two different jobs that need doing. On one side, you have drugs like NSAIDs. They're the cleanup crew. They come in and mop up the mess, the pain and swelling, but they don't stop the flood. For that, you need a plumber. And that's where Disease Modifying Antirheumatic Drugs, or DMARDs, come in. Their job is to find the burst pipe and fix it. And when we talk about DMARDs, there is one that's king: methotrexate. For most people with RA, this is the go-to, the first line of defense. It's a type of immunosuppressant, which means it works by telling that overactive immune system to just calm down, which helps prevent that long-term damage to the joints. But methotrexate isn't the only tool in the box, not by a long shot. As you can see here, the arsenal is pretty big, and it's split into two main groups. You have your traditional non-biological DMARDs, and then for the tougher cases, you bring in the heavy artillery, the biological agents. This is where treatment gets really targeted. So, these biologicals are basically super specialized weapons. Remember those cytokine alarms, those little emergency flares like TNF-alpha? Well, these drugs are like heat-seeking missiles. They are engineered to hunt down those specific signals and neutralize them. They shut the whole process down right at the source. It's pretty incredible. But because they're so powerful, they're usually saved for the most severe cases. Okay, time to do a complete 180. We're leaving the world of immune system warfare and heading into the world of chemistry. Let's talk about gout. And the best way to think about gout is as a crystal crisis. See the difference already? This is not an autoimmune disease. It's a metabolic disorder. The whole problem boils down to a chemical called uric acid. Your body either makes too much of it or it's just not getting rid of it fast enough. And when the levels of this stuff get too high in your blood, something pretty dramatic starts to happen. That too high level even has a name: hyperuricaemia. And there's a tipping point. Once your blood urate levels creep above about 6 milligrams per deciliter, it's like adding way too much sugar to a glass of iced tea. It just can't stay dissolved anymore. It starts to crash out of the solution, forming these tiny, razor-sharp crystals in your joints. And understanding gout treatment means understanding its two phases. First, you have acute gout. That's the sudden, oh my gosh, my toe is on fire attack that happens when those crystals first form. But then there's chronic gout, which is the underlying long-term problem of having too much uric acid, which can cause permanent damage and these chalky deposits called tophi. So it makes sense, right? If you've got these two different phases, the sudden attack and the long-term problem, your treatment strategy has to be two-pronged. You've got to deal with the pain now, but you also have to deal with the root cause to make sure it doesn't happen again. And here's another great way to think about it. Treating an acute attack is like fighting a fire. The goal is just to put out the flames of inflammation as fast as humanly possible. But once the fire's out, the job's not done. Then you have to switch to fire prevention, lowering the body's uric acid levels so a new fire never gets the chance to start. So for firefighting, you bring out the anti-inflammatories.
NSAIDs are usually the first thing doctors reach for. There's also a classic gout drug called colchicine that works in a really specific way to calm things down. And if those don't work, there are always corticosteroids. But notice, none of these actually do anything about the uric acid itself. They're just there to stop the pain.
Now we get to the really clever part, fire prevention. This is all about lowering uric acid. And you can do it in two main ways. You can turn down the faucet with drugs like allopurinol. They actually block the enzyme that makes uric acid in the first place. Or you can open the drain wider with drugs like probenecid, which help your kidneys flush more uric acid out of your body.
And just like methotrexate is the go-to for RA, allopurinol is the absolute cornerstone for managing chronic gout long-term. By turning down that faucet and reducing how much uric acid your body makes, it prevents those painful crystals from ever getting a chance to form. So let's just zoom out for a second. We've looked at two diseases that both cause just awful joint pain. But their stories, the reasons why they happen, are from completely different worlds. One is a case of mistaken identity by the immune system, the other is a basic chemistry problem.
And this right here is the big takeaway. This is what makes modern medicine so powerful. It's not just about covering up the symptoms. The real key is to figure out the underlying problem and fix that. For RA, you calm down a rogue immune system. For gout, you fix a chemical imbalance. It's about matching the solution to the specific problem.
Which really makes you wonder about the future, doesn't it? We've gone from simply managing pain to creating drugs that can target a single enzyme or a specific signal molecule. As that precision gets even better, you have to ask, are we getting closer to a future where we don't just treat these diseases, but we actually stop the damage before it even starts? It's a pretty incredible thought.